Hi, my name is Peder Stokke. I'm an innovation advisor in Inland Hospital Trust in Norway. I have worked with communication systems of all kinds since the early 90s, the last 20 years in the healthcare sector. And I'm now working mostly to enable healthcare personnel to communicate better through use of video communication systems of all kinds. The topic of this telemedicine course are in use of video in the pre-hospital care. I will go through a set of examples of use that are vital for this part of the healthcare system. After attending this course, you will be able to demonstrate knowledge and have an understanding on telemedicine use in pre-hospital care. Table of contents in this module is some terms in use, how the pre-hospital care work in general. Why I say in general is that there are differences between the healthcare systems in every country in the world. So I will recommend that you seek up information on how it's set up and done where you are. Today, most use radio communication or a phone call. I will say some words about that before we go into what's possible, where we also can send live video of the patient at the same time as we speak to other healthcare personnel. The last part of this course is examples of areas where video communication can be used in pre-hospital care. Pre-hospital care is all services that the healthcare system can give you before you are submitted to a hospital or other emergency healthcare facility. Most of this work is done by paramedics or ambulance personnel. Decision support is a term used where healthcare personnel seek advice or higher knowledge by contacting other healthcare personnel. Tetra radio stands for terrestrial trunked radio. What you need to know is that this is a secure radio system that police, fire departments and ambulances use to securely communicate through. I will first start to set you up in the context of how the pre-hospital care works. One person feels unwell, another person wants to help but does not have the knowledge to do so, and therefore calls the emergency response center. The emergency response center helps with any first aid and simultaneously dispatches help from pre-hospital services. An ambulance is then called, and paramedics take care of the patient when they arrive at the scene. The ambulance personnel take care of the patient and transport the patient to the nearest place for treatment of the patient's problem. In this case, we can say that communication between the person who is attending to the patient and the emergency response center is telemedicine, because they use a phone for getting help and giving advice. Secondly, the emergency response center dispatches an ambulance from the pre-hospital services through the use of a Tetra radio, and at last the paramedic on board ambulance calls the hospital to say that they are on the way with the patient. All these calls is part of telemedicine, and it is as simple as that in general. The use of radio and phone is the most common way to communicate. Every day, every assignment starts and ends with a call. But through a call with radio or phone, you only get to send and receive audio voice information. Think of blindfolding yourself. Put yourself in the other person's shoes. You have to either ask for more information or guess how it is like where the other person is. In critical communication about the patient, it is extra important that everything that is communicated in such a way that nothing is forgotten and nothing is misunderstood. This is not easy if you are blindfolded. With today's communication technology, we can take a step in a direction where we can take the blindfold off. Video is now available on all kinds of devices and wherever there are coverage for Wi-Fi, 4G or 5G networks. This opens up for new ways of communicating, but most important, it enables you to use also your eyes. Communicating with video enables also the possibility to involve more people at the same time. The use of telemedicine in pre-hospital care has been ongoing for a lot of years, with technology like radio and phone. In pre-hospital care, time is one of the most important factors. Time from when the help is asked for to the ambulance personnel arrives, from they start their triage to stabilize the patient, and time to get the patient to a nearby hospital or a doctor for our treatment. Not always all three factors are in play. Sometimes the important factor is only to get to the patient, and the treatment can start at the patient's home. And perhaps is there no more need for transport or treatment from a doctor. As more technology, medicines and new procedures are developed, more can be done by the ambulance personnel for the patient, where the patients are. In this part of this module, you will get an overview of areas for use of telemedicine in pre-hospital care.